In France, a special team has been tasked with tracing and isolating newly contaminated people and those they've been in contact with. Guillaume Petit takes a look at one of those investigation units.
Afin de m'assurer de votre identité, je vais en premier lieu confirmer avec vous votre nom, prénom.
This is one of the 200 advisors you could have on the phone in France if you contract COVID-19. We are at the heart of one of the public health insurance COVID-19 units, a special branch of the French social security system. Its mission is to contact people who have COVID-19 and all the people they've been in contact with during the 48 hours before the onset of symptoms.
On va définir avec eux déjà.
We'll define with them whether they've been in contact with an infected person and if they were respecting social distancing when they were in contact with patient zero. If there's a risk, we consider them as contact cases. We'll let them get tested as quickly as possible.
This system was put in place to prevent new outbreaks when authorities started easing lockdown restrictions. In 15 days, 1,000 calls were made. A long investigation for these professionals who are used to handle sensitive data.
We have health insurance advisors and medical referrals with doctors and nurses, which is very important to answer the questions that patients have.
One of these questions might be about confidentiality. According to the health insurance, the data is only accessible by these special units, doctors and pharmacies. The data will be destroyed after 3 months. The goal is clear: avoid a second wave.
On n'est plus dans un confinement populationnel comme on a pu le
We're no longer in a general lockdown.
Tout le monde était confiné.
Now the goal is to quickly detect people who are at risk of being contaminated and to isolate them.
Et de les isoler. Donc on isole.
So we isolate everyone who has symptoms and those who've been in contact with people who tested positive. And we try to do so as quickly as possible.
Le plus rapidement possible.
The general practitioner is at the root of these investigations. He alerts the special unit when a patient develops symptoms. As privacy concerns over tracing apps grow, patients are reassured that their data is handled with care.
The bond and trust with GPs has existed for a long time. Studies have shown that. And I think in a situation like this, that's even more true.
The crisis might also have increased privacy concerns.
As many other European countries, France has developed one application. Its users who've been affected by COVID-19 can alert the people they've been in contact with. The National Assembly gave its go-ahead this Wednesday, but this application has one limit: its use is voluntary, which questions its long-term effectiveness. In Lyon, Guillaume Petit for Euronews.